1 minute.
Basavaraj sir.
ಮೈಕ್ ಮೇಲೆ ಇದ್ದು
ಸರ್ ಅಲ್ಲಿ ಒಂದು ಸರ್ ಅದ್ರ ಒಳಗಡೆ ಒಂದು ಇದು ಅನ್ಮ್ಯೂಟ್ ಈ ತರ ಕಾಣಿಸ್ತಾ ಇರೋದು ನೋಡಿ ಸರ್, ಅದ್ರ ಮೇಲೆ ಬಟನ್ ಮೇಲೆ ಕ್ಲಿಕ್ ಮಾಡಿ.
ಮೈಕ್ ಇದೆ ನೋಡಿ,
ರೆಡ್ ಕಲರ್ ಬಟನ್ ಮೈಕ್ ಇದೆ ನೋಡಿ, ಅದ್ರ ಮೇಲೆ ಕ್ಲಿಕ್ ಮಾಡಿ ಸರ್.
ನನ್ ವಾಯ್ಸ್ ಕೇಳಿಸ್ತಾ ಇದೀನಾ?
ನಂದು ಕೆನಾಟ್ ಅನ್ಮ್ಯೂಟ್ ಅಂತ ಇದೆ, ಕೆನಾಟ್ ಅನ್ಮ್ಯೂಟ್ ಸಮ್ವನ್ ಅಂತ ಇದೆ ಅಷ್ಟೇ.
ಇರಿ
ಕೇಳಿಸ್ತಾ ಇದೆ ಗೀತಾ? ಅಲ್ಲ, ಐ ನಾಟ್ ಡೂ ದ ಅನ್ಮ್ಯೂಟ್. ಸರ್ ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೋಬೇಕು.
ಐ ಕಾಲ್
ಸರ್ ಅದ್ರಲ್ಲಿ ಸರ್ ಮಾತಾಡೋದು ಕೇಳಿಸ್ತಾ ಇದೆಯಲ್ಲ ಸರ್? ಸರ್ ಮಾತಾಡೋದು ಕೇಳಿಸ್ತಾ ಇದೆಯಲ್ಲ ಸರ್? ನೀವು ಕೈ ಓಕೆ ಅಂತ ಹೀಗೆ ತೋರಿಸಿ ಸರ್, ಓಕೆ ಅಂತ ಕೈ ತೋರಿಸಿ ಸರ್. ಮಾತಾಡೋದು ಕೇಳಿಸ್ತಾ ಇದೆ.
ಮ್ಯಾಮ್ ಬಹುಶಃ ಅವರಿಗೆ ಆಪ್ಷನ್ಸ್ ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ ಮ್ಯಾಮ್. ಅದು
ಇಲ್ಲ, ಯಾರೋ ಅವ್ರ ಜೊತೆ ಮೇಡಮ್ ಸಮೋನ್ ಇಸ್ ದೇರ್ ವಿತ್ ಸರ್. ಮೋಸ್ಟ್ಲಿ ಅವ್ರ ಮಕ್ಕಳು ಯಾರೋ ಇದೆ. ಎಸ್ ಸರ್, ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ ಸರ್, ಪ್ಲೀಸ್.
ಹಲೋ ಸರ್.
ಸರ್ ನೀವು ಅನ್ಮ್ಯೂಟ್ ಆಗಿದೆ ಸರ್, ಮಾತಾಡ್ಬೋದು ಸರ್.
ಓಕೆ ಮೇಡಮ್, ಓಕೆ.
ಸರ್ ನಮಸ್ತೆ.
ನಮಸ್ತೆ ನಮಸ್ತೆ ಸರ್, ನಮಸ್ತೆ
ಸರ್. ತುಂಬಾ ಖುಷಿ ಆಯ್ತು ಜಿಲೋಕ ಬಗ್ಗೆ ಹೇಳಿದ್ರಿ. ಯಾಕಂದ್ರೆ ನಾವು ಶಲ್ಯ ಚಿಕಿತ್ಸಕ ಆಗಿ ಅರ್ಧ ಚಿಕಿತ್ಸಾ ಅಂತ ಹೇಳ್ತಿದೀವಿ. ಆಮೇಲೆ ಪ್ರಾಕ್ಟಿಕಲಿ ನೋಡಿದ್ವಿ, ಎಲ್ಲರೂ ನೋಡಿದ್ರು ಸರ್. ಇವಾಗ ಜಿಲೋಕ ಬಗ್ಗೆ
Sir, please ask in English, sir, because others people are also joining.
No problem, madam. I will ask in English only, madam. Just previously we have seen only in books and some others we have practically we seen, sir, whatever presented yesterday, sir. So we have small doubts about leeches, sir.
Okay, sir.
Sir, one actually in my PG during the PG I also published one article regarding the thrombosed pile mass leach application. I will also send this in group, sir.
Okay.
And I have also same result what we have shown, sir. Then regarding the leach, in a single patient we will use a 4 to 5 leeches, sir. So coming to the cost also, how we will manage, sir? One, and after the using same leech should be used after how many days, sir? After Vamana Karma of the leeches. Then also, is the leeches we will cultivate in single jar or we will use a separate like that? Because we will use in carcinoma or infected cases, the same leeches may be used by others or the same leeches used by the same person. So we will clarify this.
Sir, regarding thrombosed piles and all these things, whatever your question is very nice, sir. The thing is that after once using the leech, we should give rest for 1 week. So otherwise it will go, if it doesn't vomits, it will get the Indramata.
Okay, sir.
It was explained by Sushruta only. And according to me, in my practice, I never used to apply for another patient. I will keep it for single patient only. And one more thing I want to clarify here clearly. Leeches doesn't contain any infections inside because it contains hirudin. It is having antibacterial properties, antiviral properties, and antifungal properties. That's why if you use for another person also, there is nothing harmful. But for the sake of personal use, so I won't allow this one. If you are using for a single patient, that you can use for that patient only. Don't use for the another patient. Even somebody is having the doubt that if the patient is suffering from HIV or HBsAg, it be used to another person. But the National Institute of Virology has clearly given that these viruses doesn't survive in any other, only except the human beings and monkeys. Okay.
So single leech, how many settings we will use, sir, for same patient?
For same patient, you can use for 3 times, 4 times, no problem.
After 3-4 times, what you will do for leeches, sir? For Icha Marana, like that, you will cultivate like the.
No. Just will put it simply. Don't. I won't sacrifice. Don't I sacrifice? Because I will consider this as a god. To be frank with you, I will not sacrifice until and unless his lifespan is collapses. Until and unless I will save that one. I will keep it in
provide food. Later we will provide food, some food like that.
Nothing is required. Only the leaves of the lotus and all these things it required. Even if you put a mud, that is enough. It will survive, no problem. Even if you won't put anything, it will survive for 1 year, no problem. The lifespan is 1 year, no doubt.
I think only
One small.
I think only changing the water weekly once or 10 days, it will
madam.
survive for.
No. Water, we should change water daily.
No, I am changing weekly also. It is surviving for more than 1 year.
No, of course, I am telling that you have to change water daily, fresh water. Jalaya vasa jalavoka. So it lives in water only. The fresh water and oxygen it gets from the water only. That's why I used to tell that everyone change the water at least minimum for 2 days. You have to change the water.
Okay, sir. But what I have seen, sir, in Ravi Shankar Parveji, sir, they have made a like fish that box. They will connect it with the oxygen also, sir, for leeches.
That aquarium.
Aquarium.
Aquarium. You can put no problem. You can whatever it may be, but you have to change the water.
Water. Okay.
Water.
Thank you, sir.
Fresh water is required.
Next, Sudeep, sir.
Sir, yesterday I was shown in many cases of tumor after applying the Jaloka, the size was reduced. I too applied in many patients, sir. Initially, the size will reduce, but after that, I seen growth will be more rapid than the previous growth. What's your opinion, sir, or what's the other precaution we can take, sir? I too tried in almost 5 to 6 patients, sir. All the patient initially growth was reduced, but after that, growth was so rapid than the previous growth, sir.
So I think whatever the case may be, Shofa, I told you previously only, Shofa Sadhya Raga Ruja Shamam. So when you apply the Jalokas, later on you have to do Unaprakshanala and you have to use some Panchavalkala and all these things. Otherwise you may be seen, but 99% the growth will be disappear. 99%. No growth. Yes, my clinical experience. If there is a pustulase or pus is there, you have to drain it. No, without any problem. You can drain it. Otherwise, if it is not subsiding, then you can do prachana karma or ghatiyantra you can use. Otherwise, you can use the cup. No problem. You can use.
Sir, in what all the patient I tried, in that there is no pus, nothing. All are benign and malignant tumors. Initially, as you told, growth was reducing, sir. After that, the growth was become so rapid. That's what my doubt, sir. Why it occurred?
Just you can give them Shothara drugs, no problem.
Shothara drugs, sir. Any specific drug you indicate, sir? Any specific drug, sir, you recommend?
Kanchanar Gugul you can use. Trayantadi Kashayam you can use. Varunadi Grita you can use. Varunadi Kashayam you can use. Whatever it may be. And Lepas, Dashanga Lepa and all these things you can use. No problem.
Okay, sir. Sir, another question is, as you wrote, yesterday you shown on Jaloka application in breast cancer. Only Jaloka application was tried or any oral medicines are tried, sir, along with that?
No, oral medicine. No. Just of course, because what is the multi-drug therapy? It indicates in they will give radiotherapy, chemotherapy, different types. Like that, what in Arbuda, according to diseases, we have to give the oral medicines. It's a must. I used to give both combination. Then only we'll get the 100% result.
Okay, sir. Thank you, sir.
Sir, one question in chat box, sir. Jaloka application in Venga case, have you tried? Your experience, please, sir. Jaloka application.
Yes. Yeah. Venga, Nilika, Nacha, in all cases, you can apply the leeches. It is indication. And if it is not subsiding, then you can do Udgharshana with Cephalika Patra.
Okay, sir. Sir, after Udgarshana, anything to be applied on the Venga, sir?
Nothing, only Shatadota Gruta you can apply.
Only Shatadotara. Internal medicine, sir, for Venga?
Venga, you can give that Mahatikta Kashayam, you can give Vajraka Kashayam, you can give Mahatikta Grita, you can give, no problem.
Sir, sir.
You can use, no problem.
Sir, this Vajra, sir, one Kashaya you told, sir.
Vajra Kashayam.
Sir?
Vajraka Kashayam.
Vajraka Kashaya contains what, sir? And which is referred?
Karanja is the main drug in that Vajra Kashayam. You can
Okay.
use. Karanja, Aragvada, you can use.
Which company, sir? That is?
It comes of AVS, AVN, Aravidishala Kotakal.
Okay, sir.
It is in Kashaya form also and both tablet form also. Both.
Okay, sir.
Okay.
Any questions? Now you can raise your hand and unmute and yes, Nivedita, you can go ahead. And after that, we can take yesterday question. And yesterday question is by Geeta Madam.
Yes, yes.
Ma'am, shall I ask?
Yes, yes, Nivedita.
Yes,
please.
good evening, sir. I had asked you yesterday that have you treated any snake bite case? Because one of my relatives, some snake had bitten when he had gone to Goa on a trip. So after that, they have shifted him to a hospital in Goa. It took 1 hour. They had tied some bandage, and the patient had lost consciousness. Now they are saying like they have operated for something. So when asked, they said there is cerebral edema. So it might be neurotoxic, cobra, neurotoxic snake. So cobra. So now the patient is in ICU. He doesn't have consciousness. So now today it's like BP is stabilizing. So can we do? But when you refer to that COVID case, sir, like on the lips you applied some Suvarna Tamra Loha Basma and all. So can we do something in this case?
So Mahagada, one drug comes. Mahagada.
Okay,
that
sir.
you can do, and you can do Prachana Rakta Mokshana, just the Kakapada, what they have told, no? That Prachana Rakta Mokshana you have to do on the head.
Okay.
That it will give you the result.
He is in ICU in Goa, sir. We have to take
No,
their
you can
permission.
take the permission of the doctor. You can take the permission and you can do it.
Prachana Rakta Mokshana on
Head.
which
Crown head.
Okay, sir. What is this about Mahagada? Because
Mahagada,
I
it
don't know.
contains Shirisha and all these drugs.
Okay.
You have to prepare with that. Shirisha is the main combination. And even if you administer as a nasya like that, that also will give you the result.
Okay. Internally, how to give, sir?
Mahagada, you can prepare it. You can give it in a Sorasa form or Kalka form, or you can give it in the tablet form. Mahagada. If you want, I will give you the details. Okay.
Yes, sir. I wanted. When can I contact you, sir?
Tomorrow morning, definitely I will give you. You can call me in the at 11 o'clock or 12 o'clock. I will give you.
Okay, sir. Okay, sir. I'll call you tomorrow, sir.
Okay.
Thank you.
Sure. Okay.
Yesterday, some questions are there in the chat box. I'll read it for you, Dr. Basavaraj.
Okay.
After Rakta Mokshana, for how long bleeding continues?
So, according to me, bleeding will be there. If you do the tight bandage, immediately it will stop. Immediately. In few cases, it will take for 10 to 12 hours, 8 hours. You have to change the dressing. If it is soaked, the whole surgery pad, you have to remove it and you can put another surgery pad. That's enough. If it is bleeding more, you have to apply only spatika. Otherwise, you can put haridra, turmeric powder on that and you can do the tight bandage. It will subside immediately. It will stop oozing.
Sir, whether we have to do tight binding to stop the bleeding or let it be for some time, how it is, sir?
No. Once it is started bleeding, allow it for at least 5 to 10 minutes. Later on, you have to apply the bandage.
Sir, okay, sir. To stop the bleeding immediately, is it needed to apply spatika for immediate stopping
For
the bleeding?
Agre Sravati Dushtashrak. First, the question is that Agre Sravati Dushtashrak. When it's oozing, let it to ooze it, bleed it, because Dushtarakta has to come out. Our intention. After that, if you're feeling much it is bleeding, then immediately you can stop, no doubt. Otherwise, simply put the bandage, it will stop.
Okay, sir. So let it be bleed for how many hours or minutes?
No, not hours like that. Only for 3 to 4 minutes, 5 minutes,
Okay.
enough. Then you can apply, no problem.
Okay, thank you so much.
Otherwise, immediately you can do, no problem.
How
Okay.
to avoid the scar if applied over the face?
Scar, you won't get the scar maximum in maximum patients. Only you have to apply Shatadauta Gruta or Panchavalkala Kvata Prakshalana, you have to do enough. Otherwise, you can apply Madhu, no problem. Shatadauta Gruta is the best.
Udaya Ramesh madam is asking, please share your address. I am from Kalburgi, so to send a patient.
I am Dr. Basavaraj Swami, Sanjeevani Ayur Care Hospital, KHP Colony, behind old MLA office,
Here too, Udaya ma'am. Don't worry.
Basavakaland. Only just near Ambedkar Circle it is. Old, behind old MLA office. Sanjeevani Ayur Care Hospital.
Okay. If Jaloka was applied on site of pain only, sir. Jaloka will be applied only in the pain area if she is asking. He is
No,
asking.
no, not like that. It is having the capacity to suck from the Chaturangala. Even Gada, Grathita, Avagada, it is even if it is deep, you can apply anywhere, no problem. But wherever pain is there, you can where Atyugra Ruja is there, you can apply, no problem. Atyugra Ruja, where there you can apply.
Okay. Any Purva Karma and Pashyat Karma for Jaloka Charana?
So according to me, whenever we do in Sharad Rutu, as a preventive aspect, you have to give for 3 days only simple snehapana. That's enough. Otherwise, no need. Only Purva Karma means you should not use spirit and all this thing. When you are applying for that particular area, all the peoples will do, they will apply spirit and betadine and all these things. No, you should not do. It will not suck the blood. And it won't apply because of the sensitiveness.
Allergic
So wash
to smell. That is.
with fresh water only. That's enough.
Sir, can you please repeat the medicine for gallstones?
Gallstones. So, as for my experience in gallstones, Tamra Bhasma, Punarnava Mandura, Yakrut Plihari Loha, 10 grams of Tamra Bhasma I used to take, 50 grams of Punarnava Mandura, and 50 grams of Yakrut Plihari Loha, and I will make it in a fine powder, and I will make it 120, this sachet. Okay. Then I will mix with Karela juice 20 ml, Kumar Asava 20 ml, and Rohita Karishtam 20 ml, and 20 ml of water I will mix and I will give it to the patients. And Gomutra Shilajitu. Gomutra Shilajitu, it works excellently. Along with, you can give Pittarechaka Kotha and all these things. 100% you will get the result within 2 months.
Thank you.
Sir, Yakrut Plihari how much, sir? Missed that.
50 gram.
Yakrut Plihari 50 gram, Tamra 10, Punarnavadi Mandura 50 gram. We have to mix it properly. We have to do the Mardana properly and do the 125 milligram of tablet form, powder form. And it has to be for BD dosage, sir.
BD dose.
BD dosage along with 20 ml of Karela, 20 ml of Kumari, 20 ml of Rohita Arishta.
Rohita Karishta.
Only this much, sir. Rohita Karishta.
Even you can, I am telling you, the Gomutra Shilajitu, according to different, you can use. In sometimes I used to use Varanadi Kashayam also, and Vasa Gulchadi Kashayam also I used to use in my clinical practice. But this is the result oriented one, what I am telling is.
Sir, I can understand Varanadi Kashaya, but why Vasa Guluchadi, sir?
So in the bile duct, if it may be some obstruction, that will release. And to flow the bile speed, Vasa Guluchadi.
Sir, usually we tell Vasa is a Rakta Pittahara main.
Yes. Yeah.
So, how Srota overall, sir?
There only simply that one bile obstruction is there, it will release the Shorto Shodhana. That's enough.
Okay, thank you, sir.
Can we apply Jaloka in all thyroid cases?
Any nodular goiter, thyroiditis, or anything, hypo or hyper, if the patient is having discomfort in the neck region, you can apply the Jalokas.
Sir, have you treated any tongue cancer cases?
Yeah, I have treated so many tongue cancer cases, and I have applied Jaloka on the tongue also, and even I did Agni Karma in the tongue only. Yesterday only I did one, 3 days before only I did one Agni Karma on the tongue. If you want, I will send that video also.
Please share it.
Okay, sure, definitely.
Sir, I have in acute abdomen, in appendicitis, Jaloka was applied at site of pain itself.
Yes, exactly on the McBurn point you have to apply. And apart from that, first you have to do Shiraveda. Shiraveda first you have to do. Sadhya Raga Rugasham. Yes, immediately. You can consider, you don't think it as a appendicitis, you can consider it as a Abhyantara Vidradi itself. According to our classics, you can consider it as a Abhyantara Vidradi, and you can do it immediately for more than 150 ml. If you draw, you will get the pain subsided, and after application of Jaloka, you won't get the, even if you do the scanning, you will get the normal abdominal scan.
Sir,
For
what
it's
will
not
be
only
the
single case I
duration
did,
of,
more than 5 to 10 cases I have tried this one.
sir, what will be the time gap for this Siraveda and Jaloka application, sir?
Immediately you can do. Immediately, no problem.
Okay, thank you, sir.
Soon after Shiraveda Rakta Mokshana, pain will subside, and directly you can do Jaloka Charna.
Okay, sir, thank you, sir.
Sir, Siravedana at which point, sir?
Right cubital fossa from the vein, you can do it from here only. You have to take 18 number needle. You can take a 18 number needle and cut an IV set more than for 10 to 20 centimeters. And just how you what we will do that blood donation camp. Like that only, just you can pick it. Simply the blood will flow outside.
Okay, sir. And the leech application at McBurney point.
McBurn point.
Okay, sir. Sir, did you give any internal medications like Triantha, Dikasham and all? Can we try in appendicitis?
Yeah,
Along
you
with
can
this.
do no problem. Varnadi Grita, Varnadi Kashayam, Sukumara Gritam, you can give it to use orally. And if the pain is more, Shula Vajrani Rasa, you can give for 3 to 4 times, 4 tablets. No problem.
Okay, sir. Thank you, sir.
Please tell me in case of adenoids and mouth breathing in children.
Just I will share one, just where I applied this leeches in adenoid cases. I will share you the link. You can apply, no problem.
Okay. One question from my end. Have you treated any umbilical hernia, inguinal hernia cases?
But I used to do Agni Karma in umbilical hernia and all these things. And Chakrabasti, what is that? I am doing that one. And Antra Vruddhi Hara Gulika, Shukumara Kashayam, and Lashuna Irandadi Kashayam I am using.
Okay. If it is in second stage or like that, protrusion is
Up to seconds you can do it. But if it is over the limit, you can't do anything. Surgical. You have to go for surgery.
okay. Thank you.
Sir, please repeat the medicine, sir.
For hernia,
Yes, sir.
Yes, sir.
Antra Vruddhi Hara Gulika, Sukumara Kashayam, Lashuna Irandadi Kashayam. Even you can use Sukumara Krita and Sukumara Leham also, both.
And Agni Karma and
Agni Karma I used to do regularly.
one more is
Even if the patient is having renal calculi, if it is on the right side, you have to do left side on the toe. Exactly on the toe. If you do the Agni Karma, immediately the pain will subside.
oh, nice.
If it is in left side, you have to do in right side toe.
Sir, even with the karma is done in the same way, no, sir?
Yeah.
Any more questions?
Sir,
What are the contraindications, sir? What
For
are the
Jaloka China?
contraindications?
One
Yes.
second, sir. Before, sir, Andhra Ruddhi hernia case you told, no, sir. How many times Agni Karma we have to do, sir? And what?
Weekly once.
Weekly once. For
Weekly once.
for how many days? How many times, sir?
3 to 4 sittings.
Thank you so much. Yes, sir. Naina, please go ahead.
One more you said, Basavaraj.
Yeah.
Something you said for the umbilical hernia. One more therapy.
Chakrabasti.
Chakrabasti.
Chakrabasti. Like that Katibasti only. We have to apply the soils and we have to put umbilicus. Like same Katibasti. You
Sir,
have to do
what
on
is
abdomen.
suitable oil, sir? Because I am having one umbilical hernia which is bigger in size. It looks like some 3 to 4 centimeter in width and diameter, sir. It is 3 to 4 centimeter. Initially, I thought it is some mass. Radiologist suggested for surgery. I asked her to keep the pichu, air and the pichu, and on that it becomes something smooth. Now it is, and she is the patient of this liver enlargement liver, and she is having this other endometriosis and other adenomasis. She is having, sir, even fibroiditis, and
So the thing is that if the patient is having hepatomegaly,
sir.
just you do one thing. You check his left hand, all these things. Only you do Rakta Mokshana as a Siraveda, what I told previously, in the right cubital fossa, and give mild pressure. Slowly you put pressure from both hands on the liver. Slowly you have to put pressure, and like that only the blood will flow out. In my case, what I used to do, I am telling you this frankly, after immediately, previous for 14 days or 15 days, I have given the medicines for hepatomegaly. And after doing Rakta Mokshana, I sent it this for sonography. And that in that case, in 4 to 5 cases, I have seen that soon after Rakta Mokshana, Shiraveda Rakta Mokshana, there is no hepatomegaly. The liver is normal. This I have
So
seen.
patient is newly detected hypertension also. She is stress related person, sir. She is a stress having because of so many things. Can we
For
do?
For hypertensive patients, you apply leech on one is on the hand,
Okay,
and
sir.
another one is on shoulder, and another one is on temporal region, and another one is on the wrist near. You can do
Sir,
apply.
not Rakta Mokshana, sir. Jaloka application. Same patient I am telling, sir.
Jaloka application. Jaloka application, you do it, you will get the immediate result.
Sir,
And
hernia
for
will
one,
come down, sir. Hernia will slowly reduce, sir. That hernia, it is stagnant, sir. That centimeter size. Same
no,
patient.
I am not using Jaloka therein. I am not using in hernia. Jaloka I am not using.
So there I can go for patient is having hypertension, hepatomegaly, and endometriosis and adenomasis, sir.
Then
So
you do Shiraveda Rakta Mokshana and Jaloka Chana, you can do for that.
For that, both, sir.
Yeah.
And internal medicines, as you said, I can go with Andhra Ruddhi Hara, Gulika, and Sukumara Kashaya or Leha, and Lashuna Erandadi Kashaya and Chakrabasti.
Yes.
Chakrabasti with what, sir?
You can use Eranda Taila or Sahacharadi Taila, you can use.
Okay, sir. Actually, just Pichu only I told Eranda Taila.
And you give once in a week, early morning, just Mrudu Virechana like with Eranda, Nimamrita Eranda Taila.
Okay, sir.
Even Lashuna Eranda Kashayam is having a purgative nature. That is a Virechana one.
Okay,
that
sir.
You have to use regularly.
If you are giving Eranda Taila, so there is no pain in Andhra, sir? Because
No, nothing. Smooth evacuation with there. With hot milk, along with hot milk, you have to give, and with hot water, just Anupana, you have to give. That's enough.
Okay. Thank you so much, sir. I will give you the feedback, sir, after doing this.
Thank you.
Naina,
Okay, sir.
you can ask your question.
Sir, contraindications of Jaloka and how to differentiate poisonous and non-poisonous leeches.
No, Kapila, there are 2 types of the main, Savisha and Nirvisha. So already the category has been mentioned clearly. Kapila, Pingala, Mushaka, and all these things categories. Only that which lives in the fresh water. Nowadays, what we are using is the fresh water. It is available here only, but in north side only we will get the poisonous jalokas. Here we won't get in our areas.
How about contraindications, sir?
The patient is suffering, if he is suffering from hemophilia and all these things and bleeding disorders, you should not give the jaloka channel. You should not use. And if the patient is supposed to take ecosprin or aspirin and any rosuvastatin like drugs, you have to stop them and you have to use the jaloka.
How many days before we should stop the medications?
24 hours before. 24 hours.
Any CTBT is required before
Yeah, if in such cases you have
applying
to do the
jaloka,
CTBT.
sir. In such cases, not in all cases.
Not in all cases, not necessary. But when you are using in the anal region, you have to do CTBT.
Okay. Thank you, sir.
Next.
Hello, sir. This Vajrak Kasha you told, but it is like quite Ushna, no? So we can't use it in all patients of melasma, no? Sir, there will be some like.
No, not like that. Only Triphala and Karanja is the main drugs in the Vajrakashayam.
Okay.
You can use, no problem.
Okay, sir. Sir, and sometimes when we apply Jaloka during the rainy season, it doesn't like there is some or other this like redness or some shoot or something we see. Like I have experienced it twice. Like so, like it is not. It will be advisable that we don't apply it during the rainy season.
No, not like that. You can use in any season. You can apply. If it is a urticaria, if you are feeling it may be urticaria. If it is having urticaria, then you do Shiraveda Rakta Mokshana and give Haridra Kanda orally. That's enough.
But in Grantha it is written, no, sir, like in Pravruta, like Varsha Rutu, we should not apply. Like so.
No, if it's not. Though even though they have mentioned that only you have to collect in Sharad Rutu only leeches. In classically, we have to collect and so is it possible that practically we have to do it? At that time, it will become so much big, and even you are not in so much big size jalakos also. So you can practically what in Shastrakara they have told, according to emergency, you can use at any time. Even Basti is also contraindication so many seasons. But we are doing Basti in rainy season. Basti, indicated in only rainy season means you should not use in the summer and Grishma you should not use. Not like that. According to the dosha, bala, vyadi, we have to see. At the time you have to do. And only in Grishma Rutu only we have to do, sorry, in Vasanta Rutu only we have to do Vamana means not it's for diseases you can do at any time, anywhere you can do. Even if your patient is contraindicated, then also we used to administer Laghu Vamana. Laghu Vamana means simply we'll give the milk and just Madanaphala Churna will allow to lick it. Definitely the patient will vomit and we will get the result, no problem. Even in some Tamakaswasa cases also, it's a severe conditions. Just simply we'll allow to drink the estima the Fanta and milk and we'll give this Madana Falachurna along with honey and Saindava. We will lick without any Purva Karma and all these things. Directly. That we will call as Laghu Vamana. You can give it. No need. According to dosha, bala and all these things, you have to keep in your mind only. According to Rutu, whatever the regimes we have to follow. For that is swastha. And for diseases, we have to treat according to capacity.
Dr.
It's my
Santosh.
Okay, sir. Thank you.
Dr. Santosh.
ಹೇಳಿ ಮೇಡಮ್.
You can ask your question. You raised the hand, right?
ಮೊದಲಿಂದ ಸ್ಟಾರ್ಟಿಂಗ್ ಇದೆ ಮೇಡಮ್ ಅದು.
Okay.
ಸರ್ ಇದು ಹರ್ನಿಯಾ ಕೇಸಲ್ಲಿ ಹೇಳಿದ್ರಲ್ಲ ಸರ್, ಮೋರ್ ದೆನ್ 1 ಸೆಂಟಿಮೀಟರ್ ಈಸ್ ಇಂಡಿಕೇಟೆಡ್ ಫಾರ್ ಸರ್ಜರಿ ಅಂತಾರೆ. ಆ ಕೇಸಲ್ಲೂ ಮಾಡಬಹುದಾ ಅಗ್ನಿಕರ್ಮ ಸರ್?
ಎಲ್ಲಿ?
ಇನ್ ಅಂಬಲಿಕಲ್ ಹರ್ನಿಯಾ.
You can do anywhere. No, you can do Agni Karma.
You can do, sir.
Can do.
Okay, sir.
Today
Thank
I
you.
have posted one video of Dr. Basavaraj sir's. Okay, lipoma. It was very interesting. He has treated with only Agni Karma.
ನೋಡಿದೀವಿ madam, ನೋಡಿ.
Really hats off to you. Dr.
Without blood,
Nivedita?
ಶೇರ್ ಮಾಡಿದ್ದೇನೆ ಅದ ನಿಮ್ಗೆ?
ನಾ ಮಾಡಿದ್ದೀನಿ ಅಲ್ಲಿ ಗ್ರೂಪ್ ಅಲ್ಲಿ ಮಾಡಿದ್ದೀನಿ.
ಹೌದಾ? ಓಕೆ 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 ಓಕೆ.
Ma'am, without anesthesia?
Without anesthesia, without any local, without blood loss. Simple. And one more thing that some people will ask for that questions whether you have to stitch the wound or not. If some other those we have seen for them, I am telling you. In case of after Kshara Karma, Agni Karma and Visha, you should not suture. Sushruta is given clear cut picture. Is it audible?
Dr. Deepa, mute it.
Is it audible? Some disturbance is there?
Now audible.
So after Kshara Karma, Agni Karma and Vishajusta, whenever the person is become poisonous and all these things, and whenever you can see that dog bites and snake bites, you should not suture. According to Sushruta, so you should flow it outside only. You should not suture. Only Ropana Chikitsa you have to do.
Thank you.
Is it clear?
Yes. Thank you. Now, Dr. Deepa, you can ask your question.
Namaste, sir. Sir, how many leeches we need according to the condition? How to identify, sir? For example, in varicose veins and all. For one sitting, how many leeches we can use, sir?
See, there is no limitations according to the patient's bala.
Yes, sir.
So I used in my clinical practice, I have applied for 5 leeches, 10 leeches, up to 13 leeches I have applied in so many cases.
Thank you, sir. Sir, after application of leech, I am practicing leech, sir. I'll be finding that wound or that scar will be there, no, sir? How to manage, means how to avoid those scars?
Just simply you can apply Shatadavata Gruta, it will vanish.
Thank you, sir.
Dr. Nivedita?
Sir, in this umbilical hernia case, till how many centimeters can we take for this Chakravarti?
Madam, for 1 week you have to do regularly.
No,
30
sir,
to
like
30 to 45 minutes.
Size of hernia.
So, madam, actually it's a surgical case, means no use. If it is under your control, then you can do for 45 minutes minimum.
How to decide, sir, whether we can take or not?
So you have to go for sonography.
Sonography is there. The patient is yet to come. Today she was supposed to come, she didn't come, but yesterday she called me and said that it's diagnosed as hernia in USD abdomen pelvis. I don't know about the parameters still. So up to how much dimension, how much size I can take for Chakravarti?
Madam, you can do it, try, no problem. If it is not possible, then only refer for surgery.
Okay, sir. And one case I had the cellulitis patient who is a long-standing.
One thing that you should tell them to wear the abdomen belt for that patient.
Okay, sir. Okay. And the cellulitis case, sir, she was coming to me for varicose veins since 7 years. It is more than some 10-15 years of case. But in the middle, she left the medications and she got cellulitis. She got this linid, everything. The treatment is over 15 days back. Now she's fine. So I'm planning for taking up for Rakta Mokshana, inspired by your class yesterday. So I can do no, sir. Now, how many sittings could I do now? Like 3,
so you can
4?
send the picture first, and I will tell you. Okay.
And one more breast cancer case I'm treating. The treatment is going on. So initially the lump was 8 point something centimeter. So and we have started with all these our Kanchana, Google, all those medications depending things. So now after the chemo, the size has reduced to less than 2 centimeters in these 2-3 months. So now they're waiting for surgery. So now yesterday you showed the video, no sir, breast cancer cases. So I thought
Yes.
of doing raaauos because it's less than 2 now. It's 1/4 size. It's reduced with chemo. So I can try, no sir, confidently.
Definitely. Varunadikrita you can advise. Trifala Bugulu you can take. Varunadikrita.
I'm giving the kashaya, sir. No?
You can give it. Varunadi Kashayam, you can give Trayantadi Kashayam, you can give. And one more drug, that is what I am telling you, that Nimbamrutadi Panchatikta Kashayam. Very excellent result is having.
Nimbamrutadi
Pancha
panchatikta
Kashayam. And Rasasindura also you can use.
Rasasindura.
Rasasindura and Sarveshwara Parpati.
Okay, sir. Okay, so for that patient also 1 week gap.
If it is, if you're feeling this more discomfort, you can do it twice in a week.
Twice in a week. She doesn't have any pain. So when she's taking our medicine, she'll not have any pain.
So mass is there. If you're feeling that it is, you can do it twice.
If she leaves our medicines, then she'll complain of this pricking, everything. Sir, you said Rasasindura.
Rasasindura.
Okay. Okay, sir. So I'll just when I call you tomorrow, I'll just update all the things. Thank you.
Jaloka application in Venga case, have you tried your experience? Please light. Already, I think you have shared, right?
Yeah, I have shared.
Okay. CTBT also you said. How to differentiate Nirvisha Jaloka, that also cleared. Namaste, sir. As you explained, first case, appendicitis yesterday, Raktamoksha was done in cubital fossa and two Jalokas were applied. Second one, my question, what is the site of application of Jaloka?
Exactly at the point of Magbarin point.
Okay. This is also cleared already. Blood thinners, anticoagulants before Jaloka, 24 hours before you said.
24 hours before.
How to identify the medicinal leeches, that also you said. Okay. How to do Jaloka application in DVT patient? How many sessions?
Blindly you can do for 3 to 4 sittings, no problem.
In DVT cases.
DVT cases.
They might be asking place and all.
Yes, if it is wherever you can feel there.
Okay. Internal medicines in adenoids in children.
Varunadi you can use freely.
Okay. Internal medicines for renal calculi.
Renal calculi. Depending upon the size, you can use Varunadi Kashayam and Veeratarvadi Kashayam. And Shita Prabha you can use. And one more drug that Trivikrama. You can use Gokshiradi Kada, you can use Gokshiradi Kada.
Okay. Treatment for PCOD and fatty liver.
For fatty liver, just Raktamokshana from right cubital fossa, Vasa Gudichadi Kashayam, Patola Katokarada Kashayam, and Kalamega you can give. Arogyavardhini you can give.
Okay.
In PCOD, Vruddhivadika, Chandraprabhavati, Kanchanaragugulu. Freely you can use.
Okay. Thank you. Sir, please tell how to approach varicose veins according to Ayurveda. And please share your clinical experience in varicose vein and venous ulcer, which will is having recurrence.
Shirashotha, Shirajala, according to that only. Manjistadi Kashayam, you can Rakta Prasadana drugs you can use. That's it.
Okay. Thank you. Sir, please explain use of Jaloka in cellulitis.
So already yesterday I have shown that more than 10 to 15 slides, cellulitis. You
Yes,
can
yes.
apply more than 5 cases, 10. I have applied up to 13 leeches at a time. For one patient, I applied just 13 leeches daily for continuously. I told you that every twice in a week I applied.
Thank you.
More
Can
than
we
100 leeches I used for him.
Okay.
Hmm.
Thank you. Can we use Jaloka Charna in acute pancreatitis in kids of 14 years?
You can use, no problem.
Can we do Jaloka Charna as a preventive measure in case of stroke?
Yes, definitely.
And also as a seasonal Shodhana therapy like Vamana and Virechana.
In Grishma Rutu, we are compulsory, in Sharad Rutu, we used to do Rakta Mokshana only. For that, you can use Shiraveda or Jalokacharana, no problem. And even like Prachana Rakta Mokshana also you can do regularly, no problem. That's a preventive aspect.
After Agni Karma in lipoma, how about recurrent?
Recurrence. Once the lipoma has came out, then no problem. I have never asked. But I used to give Vruddhivadika Gulika and Kanchanara Gulu and Varunadika Shayam and Trayantadika Shayam regularly. I have not noticed any recurrence cases.
For how long you are given?
For 3 years. For this medicine, for 3
internal.
months. Internal for 3 months.
Okay. Jaloka in Shita Pitta and location of application, sir.
No, Jaloka and Shita Pitta, no. I used to do Shiraveda. Sarvanga, when it is Sarvanga, I used to do Shiraveda only.
In Vatarakta with the shifting pain, how to go with the Jaloka and internal medicine? Pain and Shota different joints in shifting manner.
If it is more in ankle joint, from ankle joint, you have to do Shiraveda Rakta Mokshana and you do Jalokacharana. Then you can give Kokilakshadi Kashayam and Kaishoradi Gugula.
Sir, do you use fresh leech for every session?
For single patient, if it is required, I will use fresh. Otherwise, I will give rest for 1 week for the patient leeches. If I am using for the same patient, I will repeat it, same leeches after 1 week.
Sir, what's your experience with interstitial lung disease?
Yeah, that is very different. But here, what I used to do is the Nasha Karma, and I used to do use what you can say Yelakanadi Kashayam, Dashamula Kadotrayadi Kashayam, and Tamra Sinduradi Yoga, and Loha Tamra Suvarnadi Yoga I used to do. And application of Karpuradi Taila with Saindava Lavana, I will mix and apply on the chest and back. Nasha Karma with you can do Shadbindu Taila.
Okay, thank you.
Sir, please repeat it, sir. It was very fast.
Pardon?
You have to
Sir,
repeat it.
For this lung diseases, you are asking?
ILD, ILD.
ILD. 3 or 4 cases I have treated. I got very excellent result with Elakanadi Kashayam, Dashamula Kadutrayadi Kashayam, Tamra Sinduradi Yoga, Loha Tamra Suvarna Yoga, external application with Karpuradi Taila plus Saindava Lavana. I used to mix and make it hot and apply on the chest and back and do simple Pratimarsha with Shadbindu Taila.
Thank you, sir. And with the diabetes, sir, because Ayurvedic management, I really don't know. Only the initial cases we can do, but the patients with lot of allopathic drugs, it's very difficult to control. So what do you do in diabetes?
Especially in FPS if it is high, sir.
Pardon?
if it is fasting sugar is high, sir, then sometimes
Fasting sugar is high. Don't use only nishamalaki. Nishamalaki churna along with honey you can give, no problem. You can use honey there, little quantity. And Chandra Prabhavati, Vasanta Kusmakar Rasa having excellent result in diabetes. And one more thing that everyone is telling that diabetes, you should not eat like that. You should use only Mary biscuit and all these things. You forget that one. If you eat the Mary biscuits, again it will increase the sugar level. Let them eat fiber-rich diet, no doubt. And the intervals, what they were telling, every 4th hourly you have to eat. It's not like that. You allow them to take all the fruits. It's a mixed fruits. It will give the result also. And if they were eating jawar roti, let them allow. Even wheat gluten is also contraindication in the diabetes. But in the wheat gluten is there. Of course, for that, you tell them to eat chapati. No, it's not like that. You allow them to take rich fiber diet. That's enough. Nishamalaki, Karela, and even what you can say, coriander leaves. That will give the result. What I am using in my practical is Nishamalaki is the best, and Chandra Prabhavati and Vasanta Kusmakara. It gives you the excellent result.
Sir, I'm giving, sir, just now that patient came here to take the medicine. PPBS is coming down within 1 week, but this is repeat case. And FPS, fasting is not coming down, sir. Not only this patient, sir.
Kataka Kadiradi Kashayam you can use. Kataka Kadiradi Kashayam.
Nisha Kataka Kadiradi, sir.
Yes.
Sir, I think I have used, but once again I will give, sir.
Nishamalaki.
Now I gave Ajamodadi, Chandraprabhavati, and Vasanta Kusumakara Rasa, and one more drug, sir. 4 medicines I gave.
Kataka Kadiradi Kashayam you can use. Even you can give Ayas Kruti. No problem.
Okay, sir. Thank you, sir.
Sir? Namaste, sir.
Namaste, madam. Namaste.
Sir, interstitial lung disease ಅಲ್ಲಿ sir, here Brahmana line of treatment is like usually followed now, sir. Like I wanted to clarify.
If the patient is emaciated, then you can give Ajamam Sarasayana.
Sir. Sir, I have treated 2 cases, but I always go in a Brahmana like Vasa Gruta in the Brahmana line of treatment. I have got a result, sir, but I like what the treatment protocol you gave us now. It was like I wanted to means I had a quite doubt, sir. So I am asking you.
No, Brahmana treatment, if you feel that, you can give Pushkaramrita also there. You can use, no problem.
ಸರ್ ನಾನು ಏನ್ ಮಾಡಿದ್ದೆ ಅಂದ್ರೆ ವ್ಯತ್ಯಾಸ ಚಿಕಿತ್ಸೆ ಮಾಡಿದ್ದೆ, ಸ್ವಲ್ಪ ಬ್ರಹ್ಮನ ಕೊಟ್ಟು ಸ್ವಲ್ಪ ಲಂಗನ, ಅಂದ್ರೆ ವ್ಯತ್ಯಾಸ ಮಾಡ್ಕೊಂಡು ಐ ಹ್ಯಾಡ್ ಟ್ರೀಟೆಡ್ ದಿಸ್ ಇಂಟರ್ಸ್ಟಿಷಿಯಲ್ ಲಂಗ್ ಡಿಸೀಸ್. ಸೊ ಲೈಕ್ ಸರ್ ಯಾವ ತರ ಅಪ್ರೋಚ್ ಮಾಡ್ಬೇಕು ಸರ್? ಆಕ್ಚುಲಿ ನಂದು 2 ಕೇಸಸ್ ಅಷ್ಟೇ ಸರ್ ನಾನು ಟ್ರೀಟ್ ಮಾಡಿರೋದು. ಸೊ ಐ ವಾಂಟೆಡ್ ಟು ಕ್ಲಾರಿಫೈ ಸರ್ ವಿತ್
ಏನಿಲ್ಲ, ಆ ತರ ಏನಿಲ್ಲ. ಓನ್ಲಿ ಬ್ರಹ್ಮಣ ಲಂಗನ ಮಾಡ್ಬೇಕು ಅಂತ ಆ ಮೆಂಟಾಲಿಟಿ ಏನ್ ಬೇಕಾಗಿಲ್ಲ ಅದಕ್ಕೆ. Just you can ask that patient if it is walking, he is having the breathlessness and seeing complete whether whilst climbing the stairs, if he is breathlessness, then definitely you can use Elakanadi Kashayam and Dashmula Kaditrayadi Kashayam. It will give you the excellent result.
ಸ್ವಲ್ಪ ರೂಕ್ಷನಾನೆ ಮಾಡುತ್ತಲ್ಲ ಸರ್ ಇದು ಸ್ವಲ್ಪ?
ಯಾವುದು?
ಈ ದಶಮೂಲ ಕಟುತ್ರಯಿ ಸ್ವಲ್ಪ ಕಟು ಪಾಚನ ಬರುತ್ತೆ, ವಾತ ಸ್ವಲ್ಪ ಜಾಸ್ತಿನೇ ಆಗುತ್ತಲ್ಲ?
ಇಲ್ಲ, along with that you have to use the rasayana, no? What I am telling you, Agastha Haritaki rasayana and all this you have to use. Even Haritaki also.
Okay, sir.
Okay.
Sir, please
okay,
ask
sir.
one by one.
Sir, another one case I wanted to discuss with you, sir. 35-year male, sir. Right renal large myelolipoma anta diagnose agide, but he has uncomplicated left-sided inguinal hernia. His carcinoembryonic antigen we had done, and it was negative, sir. And RFT and all are normal, sir. And even to rule out autoimmune and all, we did LFT also. Everything was within the normal range. He had approached only like he had a pain in the right, like abdominal generalized pain was there. When USG was done, these were the findings we found, sir. How to approach with this case, sir?
Vatsamayanta Krita you can give. orally,
Okay,
1
Amantaka.
spoon BD, Varanadi Kashayam, Gokshuradi Gugulu you
Okay.
can give, and give him Sahacharadi Taila Anuvasana Basti.
Okay, sir. Okay, sir. Vasti Amantaka Guruta. Sir,
Not
how
too
much
much.
like it is?
1 spoon.
Okay. Thank you, sir.
3 more questions are there. I'll read it out. Later you can ask. Okay. So, where do apply leech for BP patient? Once again, repeat.
Just here on the wrist, on the shoulder, another one is the temporal region.
Thank you. Site of Siraveda in Shita Pitta.
Kubetal Fosa,
Medicines for Purana Shita Pitta suffering from 5 years.
Haridra Khanda, Raktamrutakvata, and Sarivagana. You can give.
Thank you. Crohn's disease treatment. Crohn's disease.
I have not treated.
Cholecystitis or gallbladder stones 16 to 19 mm stones. Presenting complaint is pain in right upper abdomen, severe when takes heavy food. Kindly guide with the treatment protocol, sir. Patient not willing to go for gallbladder removal.
Already I have told this.
Yes.
If it is a pain is more, Shula Vajrani Rasa, 4 tablets you can give. And I have given the formula also. If you want, I will share right now with you. Okay.
Okay. Thank you. Dr. Vishwanath, sir.
I think Vishwa Bharati.
Vishwa Bharati, no? Okay.
Vishwa Bharati, ma'am, are you there? Nivedita.
Sir, we were discussing about this ILD line of treatment. Will this hold good for even COPD cases?
Yes, definitely. In COPD, you can use Brahat Kasturi Bhairav Rasa, Swasakuta Rasa, you can use.
Shwasakutara Rasa I've been using, sir, but don't know why nowadays I'm not getting results. I'm using it from Dudh Papeshwar Swarna Yoga also.
Brahat Kasturi Bhairav Rasa, you can use, no problem.
Which company, sir?
Dudh Papeshwar is the best.
Okay. Thank you, sir.
Even you can use Abrakabasma also. Abrakabasma. Combination of Talisadi Churna and Chausat Prahari Pippali and Abrakabasma. That is Sahasrapati Abrakabasma. Along with honey, if you give it, you will get excellent result.
Any more questions?
Sir, namaste, sir. Sir, madam, ಕೇಳ್ಬೋದಾ?
Yes, you can.
Sir, many cases in my practice, I have used Jalavakacharana in venous ulcer and varicose vein. So in such cases, what I have experienced is whenever I do Jalavakacharana, there will be a result. But after few days, that means few months or 1 year later, once again the ulcer recurs. How to manage in these cases, sir? Because my question is, when we do the Doppler study, there will be whatever the valve incompetence is there, that will be there for a lifetime damage. But how can we manage in that condition, sir?
Manjishtadi Kashayam you can use regularly for that. And Arogyavardhini Rasa you can use. And what I am telling that apply ST Madhu Taila. ST Madhu Taila and crepe bandage. Compulsory you have to tell the crepe bandage or you wear the just stockings. That's enough.
Sir, how many days actually we have to use the medication, sir? Internal medications and Jalavakacharana, how many sittings like that? 3 months like that?
Yeah, 3 months. Until the wound heals, you have to apply the Jalavakacharana. To heal the wound, I told you yesterday only, Jatyadi Taila, Arimedadi Taila and honey. You have to mix and you can apply.
Okay, sir. Sir, many patients without any ulcer, any symptomatically, they will be, patient will not be having any symptoms, but they will be having a enlargement or that prominent veins. They will be getting the Doppler study and diagnosed as varicose venous varicosity of the veins, and they will approach us. In such cases, whenever we do the Jalokacharana, the swelling of the vein will come down, but once again it will be the normal size. In that case also the same, sir, the treatment protocol and all.
Yes, you can use Panchakola Kulattadi Kashayam in that one. Along with Manjishtadi Kashayam you can use.
Okay, sir. Whether we have to suggest them for Jalokacharana, sir, in such cases, asymptomatic cases.
Definitely,
Asymptomatic.
definitely. You can do, you can do.
What pathological changes we can expect, sir, asymptomatic cases?
Simple, nothing. When the asymptomatic means whenever they feel tiredness, that will subside. And weakness, that will subside. They can walk for long period. No problem.
Whatever the this stockings and all they have to use, and along with that our treatment we have to suggest them, sir.
Yeah.
Sir, varicocele, what is your treatment? You have done these cases, sir?
What? Pardon? Varicose ulcer.
It is varicocele, sir.
Varicocele. Yeah. Sir, spermatic. You can use. No problem. You can do
Where
Jalokacharana.
we have applied, sir? Where you have applied Jalokas?
Where exactly that portion is there? You can apply.
Spermatic inguinal region, sir, or where, sir, you have applied?
In the inguinal region you can use. In the scrotal region you can use. No problem.
Scrotum also we can use, sir.
You can use.
Okay, sir. Thank you, sir.
Thank you. Thank you, Basavaraj. I think time is running out.
Any more queries?
Sir, regarding Mahagada, tomorrow can I call you after 2 o'clock, sir?
Definitely you can call me. No problem.
Okay, sorry. I have some.
Dr.
Yes.
Halam.
I think Vishwabharti ma'am, let her complete, and next Savitri ma'am.
Dr. Savitri, you can answer.
Vishwabharti ma'am?
Ma'am, complete ಆಯ್ತು ma'am, complete ಆಯ್ತು. Thank you, ma'am.
You can go ahead, ma'am. And Savitri ma'am, you can ask your question.
Sir, namaste.
Namaste, madam. Namaste.
Sir, one question, sir. What should be the gap to perform Jaloka from one sitting to other sitting, sir?
Yeah, depends upon the case. Regular, if the aggravation of the dosha is more, we can use twice or thrice in a week also. In practice, I used to like that only. If it is simple, then you give the gap of 1 week.
Yes, sir. Thank you, sir. One more question, sir. Although it is out of box, but it is my interest, sir. Like, why did you study LLB after doing BMS?
Just only for the sake of whatever the queries and the doctors are facing the problems, especially for ISN doctors. So I decided to give some justice for that one. For that way, I studied this LLB. But later on, I decided to do registration in the bar council. They told that why you are quitting your profession? Please do continue your profession only. That's why I not done the registration. That's why I started this profession continuing.
ಥ್ಯಾಂಕ್ ಯು ಸರ್. ನಾನು ಅಲ್ಲಿ 18 ವರ್ಷ ವರ್ಕ್ ಮಾಡಿದೆ ಸರ್. ಇದೆ ಸರ್ ಗುಲ್ಬರ್ಗಕ್ಕೆ, ಆಳಂದ್ ತಾಲೂಕ ನರೋಣದಲ್ಲಿ ಸರ್. ನಿಮಗೆ ಭೇಟಿ ಆಗುವಂತ ಅವಕಾಶ ನಂಗೆ ಸಿಗ್ಲಿಲ್ಲ. ನಿಮಗೆ ಪರಿಚಯ ಈಗ ಆಯ್ತು, ಖುಷಿ ಅನಿಸ್ತು. ಇನ್ನೊಂದ್ಸಾರಿ ಆ ಕಡೆ ಬಂದ್ರೆ ನಿಮ್ಮನ್ನ ಖಂಡಿತ ಭೇಟಿ ಆಗ್ತೀನಿ ಸರ್.
Definitely, madam. Definitely.
Thank you so much. Thank you.
Too late, ma'am. We'll wind up. Okay. It's already.
I think Naina is 10, 12, 15. Naina, do you have a question?
No, ma'am.
Okay. Yeah, we can wind up. Thank you so much, sir.
Thank you so much, sir.
Because it is a wonderful, sir, because ಯಾಕಂದ್ರೆ ಒಂದು ಸೆಷನ್ ಮಾಡೋದೇ ಅಷ್ಟೊಂದು ಬಿಸಿ ಇದ್ದವರು ಎರಡನೇ ಸೆಷನ್ಗೂ ನೀವು ಒಪ್ಕೊಂಡ್ರಿ. ಲೇಟ್ ನೈಟ್ ನಿಮ್ದೆಲ್ಲ ಮುಗಿಸ್ಕೊಂಡು. Thank you so much, sir, for this very nice session and question. It has almost taken 1 hour 15 minutes. And thank you, Dr. Geeta, for introducing sir to our team and our webinar. It's really
It's
nice.
my pleasure. No, it's my
And
pleasure.
Thank you, sir. And I thank all the.
It's the record one. It's the record one. As we are seeing webinars in Achar Rasayana, no one webinar took that much time. Sir's
Yes.
webinar took so much of time.
3 hours, ma'am.
So
3 hours.
Thank you, sir. Thank you.
Welcome.
Thank you.
And recording will be available within 3 to 4 days. I will share in the group that afterwards you can share.
You can stop the recording.
Okay, I will stop. We'll take because yeah, just a minute. I can. Sir, are you there, Dilip sir? Sometimes.
Yeah.
No, not
Dilip
Dilip, sir.